Hello guys, welcome to the Concepts of Medical, and today's lecture we're going to talk about the terms used in clinical anatomy, mostly basic and mostly used term in the anatomy where these are those terms where which you see each and everywhere in the anatomy book or you can hear in the lectures. So these terms are very important to be understand and clear concept about all these terms, because whenever you use these terms wherever, you should be understand about this, that this is just used for this and this is used for this, because they are usually used in pathology as well as in physiology and anatomy as well, but I just collect all of them and just here for the in anatomy terms used in anatomy in this lecture, right? So the first term here we have is the itus, and this is actually a suffix. A suffix is and this term is usually comes in the end of every word. So this means inflammation. The itus means inflammation. So here we have example. There's appendicitis. So appendix is a word, and at the end the itus word come. So this is the suffix, which means the inflammation of appendix, and tonsillitis, which means inflammation of tonsil, and arthritis and neuritis and dermatitis, etc. So these are the, wherever you see that itis word is coming at the end of any word, so it would be mean that they are talking something about the inflammation, right? So here the second one term is the ectomy or ectomy, which means it is also a suffix, which means removal from the body, means wherever you see this word at the end of any word, it means that they are talking something and the removal of something from the body, which is the appendisectomy. The first example where we have is appendisectomy, which means the removal of appendix from the body. You can see that wherever the we see that this patient has appendicitis, means inflammation of appendix. So we generally use that he has appendix, but the disease which the patient has is appendicitis, and the operation and the surgery which is done for the treatment of appendicitis is just appendicectomy, removal of appendix, right? And another is tonsillectomy, which means the removal of tonsil, and the which means the removal of tonsil, right? And gastrectomy is also a removal of gastric, and nephrectomy, right? So these are the example of this related terms. Another is otomy, which it is also a suffix, which means to open and then close a hollow organ, right? So laparotomy. So what is laparotomy? Laparotomy is a surgical incision into abdominal cavity for diagnosis or in preparation for major surgery. It is just a incision in the abdominal cavity for diagnosis, right? So and hysterotomy is also another incision in the uterus and is performed during a cesarean section. Hysterotomy is also an incision in the abdominal and in the uterus during a cesarean section, right? And cystotomy is a surgical incision into a urinary bladder. This is also an incision, which means to open and then close a hollow organ. This is an incision, and then they are just close that incision and close that hole, right? And cystolithotomy, it also a surgical removal of bladder stone through a lower abdominal incision. So this is also an incision in which we remove the surgical by which we remove the stones by surgery from the bladder, right? So these are the example of this related term. Here another example we have here is the ostomy, and this is also a suffix, which means to open hollow organ and leave it open. For example, cystomy means surgical incision into a urinary bladder. Cystotomy I've told about before, that this is a surgical incision into a urinary bladder where we just open it and just leave it open, right? And colostomy is another general term for the surgical creation of an opening into a bladder, right? And tracheostomy, it is a incision in the tracheal region. Another term we have here is oma, which is also a suffix which means a tumor. Lipoma, osteoma, neurofibroma, hemangioma, and carcinoma. These are also related to the neoplasia, and these are actually related to the cancer. We will discuss these things in detail in the pathological lecture, but now you just trust me that these are the examples of this tumor and this suffix, right? And another term is puberty. Puberty is the age at which the secondary sexual character develops, which means it is the age in which the baby or the boy or a girl just feel the secondary sexual characters in his body or her body. In the girls it is in between 12 to 15 years, and in boys it is in between 13 to 16 years, right? Another term here we have is symptoms. It is a subjective complaints of the patient about his disease, which it means that whatever the patient says himself or herself that I have this problem. So all these problems and all these complaints are symptoms, right? And sign, what are signs? These are the objective findings of the doctor on the patient. It is the objective means whatever the doctor sees or observes in the patient face or in the patient body. All these all these complaints are called signs. It means these are related terms in the diagnosis. Symptoms are just told by the patient, and signs are just observed by the doctor, right? And what is diagnosis? Diagnosis is identification of disease or determination of the nature of disease. This is very simple, right? Which whenever we want to diagnose a disease, what sort of disease is it, and we want to the what nature of disease is it. So this is called diagnosis. Another term here we have is prognosis. Prognosis is forecasting the probable course or ultimate outcome of a disease. It means that whenever we predict or estimate about a disease, that it would just create this sort of outcome in the future or in the patient. So all these probable and it are likely to be correct. All these estimation and predictions are likely to be correct. So these are estimations and predictions are called prognosis, right? Pyrexia is fever, simple as that, right? Lesion is injury or a circumscribed pathological change in the tissue, right? This is also very simple. Another term here we have is inflammation. It is the local reaction of the tissue to an injury or an abnormal stimulation caused by a physical, chemical, or biological agent. Whenever a pathogen attack or invade or on our body or somewhere or on tissue, so these tissue, the reaction of these tissue against that pathogen is actually called the inflammation. So these inflammation, the site where this inflammation is occur is characterized by the following characters, right? So that tissue and that site would whenever this inflammation is occur, that tissue and that site and that location would have swelling, and swelling is we call it swelling. The anatomical term and medical term for swelling is tumor, and pain for anatomical term we have a dolor, right? These terms are also very important for MCQs, right? And redness, it would have a redness, so redness is called rubor, right? And warmth of a heat means heatness and or warmthness, right? And it is called calor. These terms are very important, right, for MCQs. And loss of function, that tissue is also lost its function. Another term here we have is edema. Edema is swelling due to accumulation of fluid in the extracellular space. Whenever there is a fluid accumulated in extracellular space due to some problem or hemorrhage or some else problem, so this swelling is called edema. And thrombosis, what is thrombosis? Thrombosis is intravascular coagulation of blood, means whenever in our vessels, either it is artery, vein or capillaries, whenever the blood in these vessels just make a solid particles are a part of that blood or coagulate that blood, this part of blood is called thrombosis. So what is embolism? Embolism is actually occlusions of vessels by a detached or circulating thrombus. Whenever in the blood a blockage of the vessels occur due to embolus or circulating thrombus, that phenomena and that blockage due to some blood coagulation is called embolism, right? So that coagulated blood which block the blood vessel is actually called the embolus or embolism, and the phenomena is called embolism, right? And what is hemorrhage? Hemorrhage is bleeding which may be external or internal, right? This is very simple. So what is ulcer? A localized breached gap or erosion in the surface continuity of the skin or mucous membrane, means it is actually a gap in the surface, in every surface, in every organ surface, whenever there is a gap or erosion occur, so this is called ulcer. Another term we have here is the sinus. A blink tract open at one end, means a tract or a hole which is open at one end lined by epithelium is called sinus. And what is fistula? A tract open at both ends and lined by epithelium is called fistula. So these are interrelated. These are actually related terms, but here the hole or blink is open only by one end, and here it is opened by both ends, right? What is necrosis? A localized death of the tissue or organ due to irreversible damage to the nucleus, means it is a necrosis is also a big process. I'll explain it in the pathological lecture, but here we have just to a little bit view about necrosis, that it is a localized death of a tissue organ due to irreversible damage of the nucleus. Whenever the nucleus is damaged of any tissue or cell, so this is actually going into a necrosis process, which eventually ends in the death, right? Death of the cell or tissue. What is degeneration? It is a retrogressive change causing deterioration in the structural and functional qualities. Whenever there is a regressive change in the nucleus or the cells or any tissue which cause reductions in the structural and functional qualities of the tissue or cell, so this is called degeneration. It is generally reversible but may end in the necrosis, but eventually end in the death, right? What is gangrene? So gangrene is a form of necrosis or death combined with putrefaction, right? So this is a part of necrosis. Here we have another term, which is infarction. Infarction is death of the tissue due to sudden obstruction of its artery of supply, means whenever there is a death occur in the tissue due to sudden obstructions or blockage of artery, and usually and often it is in end artery. So this blockage and this death of the tissue is called infarction, right? And here it is another term, which is atrophy. Diminution in the size, means reductions in the size of cell tissue due to loss of its nutrition, means whenever there is not enough supply of nutrition to any tissue or cells, and its size just reduced down, so this condition is called atrophy. Dystrophy is diminution in the size due to defective nutrition. This is also a reduction of size of the tissue or cell, but here it is not by the loss of nutrition. Here the nutrition is enough, but here there is some defects or or falsifications in the nutrition. That's why the reduction in the size of tissues or cells occur. Hypertrophy, increase in the size due to increase in the size of the cell. increase in the size of the tissue or organ due to increase in the size of the cell is called hypertrophy, and here hyperplasia is increase in the size due to increase in the number of the cell, so that is called hyperplasia, right? So another term here we have as hypoplasia. So what is hypoplasia? Hypoplasia is actually incomplete development of a tissue or organ, where whenever the organ or tissue is just incompletely developed. So this condition is called hypoplasia, right? Aplasia, a means not, and plasia means growth. So aplasia is actually the failure of development, right? Syndrome, a group of diverse symptoms and signs constituting together the picture of a disease, means a group of symptoms is simply called syndrome, right? What is paralysis? Paralysis is loss of motor power or movement of a part of body due to degeneration or primary disease of muscles. Means whenever there is a malfunctioning in the nerves supply of any part of any organ to the body, and it is just stop its functioning and its movement, so this condition is called paralysis or any other muscle disease due to any other muscle disease, right? So hemiplegia is paralysis of one half of the body, means whenever the one half of our body is paralyzed, so this condition is called hemiplegia. So paraplegia, what is paraplegia? Paraplegia is actually the paralysis of both the lower limbs, right? Whenever both the lower limbs just paralyzed, so this condition is called paraplegia, right? Monoplegia is paralysis of any one limb, right? And quadriplegia is paralysis of all the four limbs. And anesthesia, quadriplegia, these are the paralysis, these all terms are actually related to the paralysis or paralysis, right? And here we have anesthesia. Anesthesia is loss of touch sensibility. Whenever you touch somebody and he or she did not sense it, so it means that part of that individual body is just anesthetic, right? And analgesia is loss of the pain sensibility. Whenever the body of any part or any part of the body or any person did not sense the pain, so it means that person is in analgesic condition. Thermoanesthesia means loss of the temperature sensibility, right? Hyperesthesia means abnormally increased sensibility, means whenever the sensibility of any body is abnormally increased, it means that he or she just sense each and everything abnormally and pathologically, so this condition is called hyperesthesia, right? And paresthesia is perverted feeling of sensation, means falsely feeling of sensation or false feeling or not true feelings of sensation is called paresthesia, right? Coma means deep consciousness, right? So here we have another term which is the tumor. So what is tumor? Tumor is a circumscribed non-inflammatory abnormal growth arising from the body. Tumor is I also told before that tumor is actually part of actually called a cancer, in which this is where the abnormal growth occurred in the body of any tissue, and it's not inflammatory abnormal growth and arising from any body tissue, so this is called the tumor. Benign is actually also related to the tumor, which is mild illness or growth which does not endanger life, it is also an illness or growth or cancer or tumor, but it is not endanger life, it is not so much threatened, right? And malignant, severe form of illness or growth which is resistance to treatment and ends in death. So malignant is another form of growth or illness which is resistance to the treatment, and it is very much threatened and it is very endangered to the life, and it ends in the life, and it even ends in death, right? Carcinoma is malignant growth arising from connective tissue which is either from mesodermal layer or endodermal layer. So this is the malignant growth arising from connective tissue, right? And sarcoma is malignant growth arising from connective tissue, either which is mostly from mesodermal layer, right? Cancer. What is cancer here? A general term used to indicate any malignant neoplasm which shows invasiveness and result in death of the patient. It is also a term for the neoplasm in which the body and the invasion part just show invasiveness. Invasiveness means it just invade its surrounding part as well, and it eventually results into the death of the patient. So this is condition is called cancer. Metastasis. What is metastasis? Is spread of the local disease like the cancer cell into distant part of the body is called metastasis. Metastasis is actually the characteristics of cancer or neoplasia, right? So this is also the characteristic of the cancerous cell. Convulsiveness is the recovery period between the end of the disease and restoration to complete health. You got it? So this is actually the recovery period between of the for the disease to complete to the health is called convulsiveness. And therapy is medical treatment. These terms were very important. There is a lot of terms for medical, for anatomy, or for every subject, but I just collect all these terms which are very important and which is used mostly for each and every subject. So this was all about these terms. In next video we will discuss the relations, and this was all about the medical term about clinical anatomy. If you want these hands out, just go and visit my Facebook page. The link is in the description. You can easily download it from there.